From the age of 3 to 6, I had to look after my mum and my sister because my mum wasn't very well. She had a nervous breakdown, and my sister was only 2 years old, and she didn't know what to do. So I had to be like the father figure to my mum and sister. And some days it was right, but most of the time it was pretty hard coping with different things in the family life. And it wasn't until I said stuff to my auntie, because when my mum broke down, my auntie contacted my mum and said, I think you need 3 weeks off break. And then my auntie said to me, if you ever need to speak, I'm here for you. So I said everything what happened. And then it took 2 years for my auntie to fought in the court with the police, with social services, to let me and Clay now live with my auntie. So yeah, it's been hard, but I've forgiven my mum for the things what's happened, but I haven't forgot what's happened, if that makes sense.
Healthwatch are really interested in talking to people about their experiences of health and social care services and getting feedback from people about those services. So part of why we brought you all together today is not only to have fun, hopefully, and have a nice afternoon, but also to talk to you about your experiences of those services. And then what Healthwatch does is take those experiences back to the ears of the providers and the people who pay for them. And hopefully, by doing that, we can improve services, tell them what's working, what's not working.
Looking after my mum and my little brother. Have to do all the housework, help out, and help out with the dinners and make sure all the house stuff is all right, and make sure go to appointments with mum, and make sure my little brother's all right, and go to appointments with him. So yeah.
What difficulties is your mother facing at the moment?
My mum's got depression and bipolar, and she has a good days and bad days, and she's on quite a bit of medication for it, but she's doing good.
I care for my mum and my brother. My mum has depression and my brother has autism. So pretty much I just go around, I wash up. I go home every so often because I'm at university, so I wash up, help do housework. I help with my brother's homework, my sister's homework, that kind of thing. Just generally make sure everyone's all right in the house. It was really hard to juggle both at once because obviously I've got to prioritise my time with my degree and then also make sure my family's okay on the side.
My name's Danielle. I work for Carers Trust. Has anybody heard of Carers Trust? Yeah, a few of you? Okay, so we're the largest provider of carer support services in the UK, and we work to improve the support, services and recognition of carers of all ages, so from young carers, young adult carers and carers. And I'm just going to show you a couple of websites that we have. The first one is called Life in a Spin. It's a game on our website, and it's not really for carers, it's really for anybody else. It's for the general public to help them understand a little inkling of what it might be like to be a carer. All the instructions are online, and it does have sound. So if you just play on there, there's 3 or 4 scenarios, so if you'd just like to try out a couple. So Matter is a website dedicated to young adult carers, and it's an online space where young adult carers can connect with each other, support each other, learn from each other, offer advice, and also where young adult carers can ask questions and get support from the online support workers.
She mixed with the wrong crowd. She took stuff she shouldn't have. She done things she shouldn't have. And she was very depressed because of that and because of other things, because of my dad. And it just led to my mum. When I was 1 year old, she was all right, but as soon as my dad left and started being mean towards my mum, it all kicked off and it all went downhill from that point.
What sort of challenges did you face then during that period before you moved in with your auntie?
trying to get money for food, coping with my mum, not responding to a lot of things, coping with my sister, and just trying to cope with everything as a young child, what a child shouldn't have to go through. And it was really hard.
How did you cope?
I hadn't had a choice, didn't have a choice. If it wasn't me, no one would have done it. So I just thought every day, yeah, it's not fair, but I don't have a choice. So I just thought that in my head, and that's how I programmed myself to cope.
You just kind of like get on with it, like, you know, you've got all those problems, so you can't just like run away from it. So you have to like deal with it while you can, and you got all the support around you and all that.
You can have a look at that. So with that section, so we're doing that with mum, so you can just like do dots. Just make sure that when you use this, you probably don't need to quite that much. Because it can't actually that big. So oh, sorry. You'll be able to do it. You'll be able to just do it freehand. That's what you think. I think I'll do anything else. I do that one.
What level of support, or what support actually existed for you during those times?
There wasn't. When I was living with my mum, my auntie and my nan used to come in every day, but no one knew what it was like. People used to think, because I've put a happy face on, that I'm okay, but deep down it was a nightmare. And luckily my sister can't remember anything now, because when we moved with Yvonne, she had hypnotherapy and counselling, so did I, but I warned them before it started it wasn't going to work, but it has with my sister, so I'm glad about that. It didn't particularly go well. They knew exactly what was going on before we moved to Yvonne, and they'd done nothing. Counsellors and social services done absolutely nothing. They used to come and see what it was like, but they'd done nothing. So I feel like I can't trust a lot of people, and it's taken me a long time, but now I'm getting over that. Social services used to come to our house with the money, give it to my mum, look at us, and then walk out. I don't know why they didn't do it. Maybe you should ask them, I don't know. I'm not happy what they've done. Quite frankly, I would sue them, but yeah.
I have young carers and like other social services, and like mum has like other like mental health people help around her, so that's kind of good for us.
What sort of support are you getting? Is it financial? Is it time? Is it?
It's like physical support, so like they'll have someone to like come make sure that my mum's okay, have someone to like, for like me and Thomas, so like we have someone to talk to things about. We get financial support as well, but not a lot, so yeah.
What sort of additional support would you like, if at all any?
So like instead of like say social services, instead of like going, oh, you're fine, you're capable, instead of saying that, and then going away to like actually think about maybe they need a bit more support, make sure they're all right, and all that sort of things.
Once I reached 18, obviously the young carer group I was going to couldn't really offer me any more support. And it was very hard and difficult to find another service that would support 18-year-olds upwards. At the moment, I think it's last year, so 2014, we developed a group for 18 and 25-year-olds to go to every month, just chill out, like say what they need. And that includes the Princess Royal Trust. So they pay for like some food that we can eat and just chill out, be like teenagers really. I don't think there's enough services there to help the transition between 18, from you becoming 18, because at 18 the government think that once you're 18 you can do it, like you're on your own, you're an adult, go off in the big world. But then they don't think that you also have a life, so you have to make sure that you're trying to get yourself a job and everything else, as well as making sure that you've got your family on track doing that as well.
Has anybody got anything that they feel that would benefit by being put in place that would help you guys as young carers? You know,
someone to talk to, like not being judged, not being had a go at or anything like that. Just someone, even if it's just texting or something like that or whatever, just knowing that, oh yeah, I can talk to that person, they won't judge me or anything like that. So
I think they should put like a 24/7 helpline thing, because you know you've got like childline things, but one for young carers, and like there's always someone at the other end of the phone you can talk to if you're feeling upset or you need advice or something like that. Like, I think that would be really good.
What was being discussed about having like a regular care worker, like not different people like every week or day, someone regular that the family can get to know and trust, that understand their situation and become a part of it, and I think that would be really beneficial.
My mum's got a massive issue with trust. She doesn't like strange people and things like that, so she did have adult services, but then because they interfered too much in her private life, she just told them to get lost basically. She didn't want them involved anymore. She would rather struggle in herself than have someone she doesn't know interfere. So, but yeah, she's got a massive issue with trust, so she wouldn't. That would if someone could come like every week, and then I get to know them as well as my mum, things like that. So
that's brilliant. Anything else?
As a projects worker, our point of view, we haven't ever, well, for as long as my manager's been in our position, which is 8 years, we've never had a referral from a GP, ever. We've worked with hundreds of young carers. I work on next set of projects working with 16 to 24-year-olds. Like Neymar, for instance, she didn't get referred to us until last year, but she's been a carer for...
since I was 7.
Yeah, since she was 7. So 10 years she could have got some support from young carers, but she only came through to us last year, which I think is a massive thing for us, because there's so many people out there that aren't getting support, and I think GPs need to be a lot more vocal in trying to get them support young carers.
I think the main things that came out of this is probably what Jan was saying, communication and not being listened to across the board, really.
Yeah.
And also a lack of looking at the family as a whole and the situation as a whole, because everyone's affected, but people can't seem to get that into their heads.
Affected in a different way.
Yeah, so everyone needs some kind of support or assessment or help in it.
Okay, is that it? Well, thank you, everybody.
Back then, I felt lonely, hurt, rejected, but now that I'm living with my auntie, I've had the help, people understand what it's like, I feel so much happier. I'm a different child now. If I was living with my mum, I wouldn't even become an actor. Since I lived with my auntie, it's really changed the way I am and who I am today, and I'm so thankful for that. It's been lovely.